Prior to devolution, Mombasa was considered as the regional headquarters. That means the coast region. And that is where you had all your agriculture officers, you had your public work officers, and all these other officers who were meant to serve the whole region. Come devolution, all those staff remained with the new county government of Mombasa, without necessarily saying that you're having those resources. I want to give just 3 examples. One is agriculture. All agricultural officers were retained by the county of Mombasa. We have no farms in Mombasa. 2, all the staff that are in betting and betting control and in charge of handling casinos, all of them were retained under the payroll of the county government of Mombasa. And guess what? Other than the single business permit, the only other part that comes from betting, as a matter of fact, if you look at the salaries that you're paying people who currently is when we're trying to be able to redeploy them to other areas. 3, public works. You are given staff that were in charge of public works for the whole region, that you had to be able to inherit and take over. Now, devolution comes in, new system of governance gets into place. Many factors are going to be there. Finalize the spirit of devolution the way the framers of the Constitution intended it to be. Do not take services without resources. How are you going to be able to maximize the bloated workforce? We recently did a survey where we asked the employees themselves, what can we be able to do as your employers, as management, as your governor, as the public service board? What can we be able to do from different ranges? From the sweeper, this was asked, all the way up to director level. What can we be able to do to ensure that you are going to increase your performance? And what is going to happen is, and we've seen this, the same people with a little bit of motivation, with some level of enhancement, you will realize that their performance increases. We have some very good people out there. I think it is vital for the national government not to micromanage, or rather not to try and micromanage counties. It is vital. You can be able to set policies, you can be able to set guidelines, you can be able to do anything else, but not to try and micromanage. And if we truly want to be able to handle this, and I give this homework, if you look at all the hospitals in the whole of Kenya are owned by county governments. In Mombasa, the national government does not even have a clinic. The only hospitals that are run by the national government, and I'm giving you just one sector into it, the only facility that are handled by the national government is Moi Teaching, there's Kenyatta, I think there's Madare, and there's the spinal, there are 6, yes, the national hospitals. That includes the Madare and the rest. But look at the budget that goes to the Ministry of Health vis-a-vis the budgets that go to all the other counties combined. Are our resources not going to where they're meant to be? And I think if that happens, we will not be having these conversations perennially.